for many children and teenagers, the burden of diabetes means that they always have to think about it whenever they eat anything, whenever they do any activities. Sometimes even just the stress of exams in school will affect their blood glucose levels, and it is quite a difficult disease to treat and to live with. And the other thing is they don't ever have a break from it. It's always there. They can't decide, oh, I won't have my insulin today, I just need a break from my needles. It's just because then they get sick.
By far the most common type of diabetes we see in children is type 1 diabetes, and this is something that is inherited in a way, and it is a problem with the balance of the immune system. So there is an imbalance in the regulation of our immune system. And our immune cells mistakenly think that our insulin-making cells are bad, and our immune cells go rogue and start attacking our insulin-making cells. And when we lose insulin-making cells, we develop the signs and symptoms of type 1 diabetes. So I mentioned before that type 1 diabetes starts off with an imbalance in the regulation of the immune system. So our immune cells think that our insulin-making cells are bad, and they go about destroying our insulin-making cells. So what we need is to come up with an intervention that can protect our insulin-making cells. And we can do this with immunotherapy. So the way immunotherapy might work is that it would start at the very beginning of the destructive immune process and teach our immune cells how to be good or protective towards our insulin-making cells. So the Thomas Lab, which is the group that I work with, has come up with a way to give immunotherapy to target immune cells and reprogram them to change from being cell destroyers to cell protectors of insulin-making cells.